Dr. Luscombe, I'm thinking about, we've heard PTSD mentioned, we've heard trauma mentioned. For the medical side of it, when you're looking at treating folks, just wondering if you could talk a bit about that and like what you've learned and seen through all of this with respect to how this conversation is working so far today.
Well, in my clinical experience, what we call, the diagnosis of all of this when we see kids who have been traumatized, we call it developmental trauma disorder. Of course, it's not in the DSM-5 yet. I guess the closest thing would be complex PTSD. But we know that when you experience trauma from a young age, it does look somewhat different. So we call it developmental trauma disorder. And what we do know is that these kids who have experienced what we call adverse childhood experiences, whether it be psychological, physical, sexual abuse, or general household dysfunction because of domestic violence or substance abuse, these kids experiencing this have a change that doesn't just happen that one time and then they get over it. These experiences change the way their brains are functioning. It changes how their immune system functions. It changes how their hormonal systems function. So it makes sense if you have a child who's been abused, they're going to have perhaps, more issues with mental health issues and going to school if they're living in a very unsafe environment. And then if they didn't go to school, that's going to lead to other issues. But it's not just those obvious things. It's actually studies have been done that show that kids who have experienced trauma actually have a higher risk of heart disease and a higher risk of COPD and a higher risk of cancer. And how does that even make sense? A higher risk of diabetes. And even when you take out the fact, like the other factors that may be associated with those diseases, so people who've experienced trauma but had all the money that they could, didn't have some other factors that maybe would lead them to having medical problems. We know that there's a direct response between having experienced early childhood trauma and cancer, and that's because we know that it does affect your brain. It actually changes how your DNA is replicated, and it changes how your DNA gets repaired, so your genetic material. So we know all of that. And we know the cost of not doing something.
Right.
And I guess on a positive note, Adam, is that I just want people to know as well that just because a child has been traumatized and they've gone through this doesn't mean there's not hope.
No.
There's great studies out there that show that the right kind of help at the right time can help these children no matter what ages they are at. So, making sure that they have good relationships with other people, that there's adults in their life that, they can learn from, good mentors, proper counseling. Sometimes it is medical management of some of their conditions, good mental health services. But these kids can, like Bev, grow into really productive and successful members of society, and it's not hopeless. And so when we do identify that something's happened to a child, we can intervene and we can compensate for some of the stuff that has happened to them, because we can't change what's happened. But when I talk about changes in the brain and changes in the hormone system and changes in your immune system, those things actually can be repaired in children.